and the lateral pterygoid and the suprahyoid muscles, which will help in opening the jaw. The one point I want you to note about this is the muscles which open the jaw are different from the muscles which close the jaw. Therefore, the relationship of the mandible in relation to the maxilla with the muscles around it is very important, and we need to set the teeth into that particular situation. So when we go into occlusion, what is occlusion? Simplistically stated, occlusion is just the contact of teeth. When two teeth come in contact, that is occlusion. If you look at what is centric occlusion is the position where all the teeth come in contact. It can be the maximum intercuspation position, or it can be just one single tooth in the upper and one single tooth in the lower. If they just come in contact, that is also the centric occlusion for that patient. Okay. If you bite your teeth and they come in contact, if you are going to be able to move the jaw horizontally forward and back anywhere between 0.2 millimeters and up to a distance of 1 millimeter, if there is movement, when you try it, that movement is called as the freedom in centric or long centric. When you bite and there is a freedom in centric, you move forward. Immediately from there, in that protrusive movement from long centric, if you move forward, automatically disclusion will happen. The teeth will come open. Okay, that is a small statement about the centric occlusion. Now next, what is centric relation? Centric relation can be explained in three conceptual ways, which is, one is the anatomical explanation. Centric relation is not even an occlusion. It is not the contact between teeth to teeth. It is a relative position of the mandible in relation to the maxilla. Okay, so now when you talk about it anatomically, you have the condyle inside the glenoid fossa. Okay, so now inside the glenoid fossa, this is the anterior position of the glenoid fossa. This is the posterior most. So this is the articular eminence is here. So now when the condyle is in the foremost position of the glenoid fossa and the superior most position, that is supposed to be in centric relation position. There is also an argument that it is the midmost and the superior most position in the glenoid fossa. Earlier, it used to be discussed as it being the posterior retruded most and the superior most position. So, but anatomically, there is evidence to say that it is the foremost position and the superior most position where the thickness of the articular disc is more. So they claim that it is of academic significance, and clinically it is very difficult to find out where it is actually sitting. It doesn't matter actually. When you look at it conceptually, the centric relation is the position of the mandible in relation to the maxilla with the intercondylar disc in place, where the muscles that support the mandible are at the relaxed and least strained position, the muscles of mastication. So one is the anatomic position of the condyle. Next is the muscles of mastication, which are at the least strained position. And finally, we have the geometric explanation, which is the centric relation is the position of the mandible in relation to the maxilla with the head of the condyle in the terminal hinge axis position. So what is the terminal hinge axis? Terminal hinge axis, when you draw a line, an imaginary line from the center of the head of the condyle to the other side, that when the jaw opens, it rotates initially, then it translates downwards. When you close, it translates backwards and then rotates into the final position. That final rotation where there is no movement of the condyle is supposed to be the terminal hinge axis position.